Okay, so picture this. You've had a filling, maybe a broken bone set, maybe something way bigger, and you don't remember any of the pain because you were completely out. Now imagine that option just didn't exist. No needle, no mask, nothing to knock you out. That was surgery for basically all of human history. And honestly, some of the stories from that time are wild enough that you'll want to sit down for this one. And one surgeon in this story reportedly caused 3 deaths in a single operation. Just one operation. Let's get into it. For around 6,000 years, surgery meant one thing: pain. Full stop. If you needed a limb removed before 1846, you were awake for every second of it. Surgeons weren't trying to make it painless. They were trying to make it fast, because speed was the only mercy on the table. And according to sources from the time, nobody was faster than a London surgeon named Robert Liston. His nickname was reportedly the fastest knife in the West End. Keep that in mind, because it matters in a minute. Liston would walk into a packed surgical theater, students watching, stopwatches ready, and just say, "Time me, gentlemen." His fastest recorded amputation was 28 seconds. 28 seconds to saw through a femur and stitch the wound closed, before the patient even registered what happened. This wasn't recklessness. Less time on the table meant less blood loss. Speed was the medicine. But here's where it goes sideways. During one of his signature fast amputations, Liston allegedly moved so quickly he sliced off his assistant's fingers along with the patient's leg. Then his blade caught the coat of a bystander watching nearby. That man thought he'd been stabbed and, according to the story, dropped dead from fright on the spot. The patient died of infection. The assistant died of infection. The bystander died of pure shock. 3 deaths, 1 surgery, and Liston was still considered one of the best surgeons alive. That's how desperate things were. Let's be real, that story alone sounds made up, but there's a first-hand account that backs up just how bad this era actually was. A novelist named Fanny Burney had a mastectomy in 1811 with 0 anesthetic, and she survived to write about it. She described her own scream lasting through the entire incision, so loud she said she thought it would still ring in her ears years later. She fainted twice from the pain, and her doctors considered that a successful procedure. People tried to fix this for centuries. Egyptians used opium. Greeks boiled mandrake root in wine. Medieval surgeons soaked sponges in hemlock and held them under a patient's nose and just hoped. None of it was reliable. Some of it probably killed people before the surgery even started. The most consistently effective option was straight alcohol, enough to make someone stop caring what happened next. Not dignified, but it was something. Then, in 1844, a dentist in Hartford, Connecticut accidentally stumbled onto the answer. And almost nobody believed him. His name was Horace Wells, and he'd seen a guy at a laughing gas demonstration badly cut his leg and not even notice until someone pointed out the blood. So the next morning, he had a colleague pull one of his own teeth while he breathed the gas. He felt nothing. He called it, allegedly, a new era in tooth pulling. Big claim. He was about to pay for it. He set up a public demonstration at Massachusetts General Hospital in front of the most important surgeons in America. Gas went in. Patients screamed anyway. The room erupted into boos. People reportedly shouted, "Humbug," and Wells fled the stage with his reputation gone in one afternoon. It got dark fast after that. He became addicted to chloroform. He was arrested. He died in a prison cell in 1848 by his own hand. He never found out history would eventually call him the true discoverer of anesthesia. Sit with that for a second. His former partner, William Morton, watched that whole disaster and got obsessed instead of walking away. He spent months experimenting with ether on animals, on himself, on anyone who'd sit still. Once he was sure, he convinced Boston's most respected surgeon to let him try it live. October 16, 1846, Massachusetts General, a patient with a jaw tumor breathed in the ether. The surgeon operated. The patient didn't move, not once. When it was over, the surgeon reportedly turned to the crowd and said, "Gentlemen, this is no humbug." Within days, that line crossed the Atlantic. Within weeks, surgeons everywhere were using it. One morning changed medicine forever. And here's the part almost nobody knows. Right after his biggest win of all time, Morton did something that basically destroyed his own legacy. He tried to patent anesthesia itself. He named his ether mixture Lithion and tried charging every surgeon on Earth to use it. The medical world turned on him instantly because ether had been a known chemical for over 100 years. You can't patent that. Turns out a Georgia doctor named Crawford Long had already used ether for surgery 4 years earlier in 1842. He just never bothered publishing it. Then Horace Wells's widow demanded credit for her dead husband. The chemist who'd helped Morton wanted his cut too. Suddenly, 4 different people were all claiming to be the real inventor, and Congress actually held hearings over it. Morton spent the rest of his life and every dollar he had fighting for recognition. He petitioned Congress for $100,000. Congress debated it for years and did nothing. In 1868, 22 years after that famous demonstration, Morton died broke, furious and basically forgotten. When Oliver Wendell Holmes, the poet who actually coined the word anesthesia, was asked who really deserved credit, he reportedly just said ether. Which sounds like a shrug, until you catch that it's also a pun on either. Nobody could agree. That's the whole tragedy in one word. Today, over 310 million surgeries happen worldwide every year, and every single one uses some form of anesthesia. Heart transplants, brain surgery, 12-hour cancer operations. None of it happens without that one Tuesday morning in Boston in 1846. Without it, surgery stays stuck at the surface, amputations and extractions only, and the inside of the human body stays basically locked. Every early cancer catch, every heart valve replaced, that traces straight back to a man who never got paid for changing the world. So next time you wake up from a procedure and feel absolutely nothing, remember that. Somebody died broke while people argued over who deserved the credit for that exact feeling.